Good afternoon, everyone, and welcome back to another episode of Sunday Housecall. We have a pleasure and honor to have one of my favorite guests over here, Dr. Doris Day, from one of the celebrity dermatologists who is here. And I can't tell you how many questions we got. We teased this show actually before this program, and we have so many questions for you. Doris, welcome to the show. A lot of you already know who she is. She has affiliation with Lenox Hill Hospital, and she's also associate professor of NYU Langone. And one of the reasons why I'm a big fan of her is not only she has a very successful practice, she's also a real academician. She goes to conferences. I've seen you in action. You like to teach. And that's the kind of caliber of doctors that we want to have over here. So Doris, welcome.
Thank you. Thanks so much for having me.
You're welcome. We're going to learn a lot from you. I can't tell you how many ladies out there want to look more beautiful, want to get rid of those wrinkles, and also we'll have a whole session talking about Botox and laser toward the end of the show. But, of course, it's a time of the year where the season is changing. And the kind of questions that we have is, why are they talking about skin cancer and screening and lotions now when it's at the end of summer and we're going to winter? And your answer would be?
Is that you need sun protection every day, all year round. And the reality is that UV rays don't really care about how hot or cold it is. And as the days get shorter, those UVB rays, which are the burning rays, may be less and more concentrated in the middle of the day, and we may not spend as much time outdoors. But we now know that UVA rays, which really is 90% of the rays that reach the earth, also cause skin aging and skin cancer. So you need to protect every day, all year round. And there's a lot of data and clinical trials and studies that show this to be true.
So let me ask you something. So of course, when I was much younger, I was so into tanning. I love the color of the tan. So unfortunately, there has been some damage we've all done. And in fact, I was reading one of the studies that says if you have 4 to 5 sunburns as a kid, you increase the risk of your skin cancer twofold. And that's a scary statistics.
Yeah.
So wintertime, we don't realize how much sun is getting through the clouds. Is that one of the concerns that you have?
Yeah, clouds only block about 20% of the UV rays, so most of the rays get through. And I had a patient who came in and she had some lines around her eyes. She was a young woman, maybe in her late 20s. And I said, well, you need sun protection and sunglasses. And she said, but I like being tanned. So I came up with one of my favorite lines, and it's that if you like being tanned, you better love being wrinkled. And, and that's a problem, because people spend so much money on all the products and treatments and procedures, and most of what we're trying to do with all those things is undo the damage from the sun. 90% of how your skin ages is due to UV exposure, also to pollution, stress, smoking, things like that, but most of it is really done from UV rays. And then there was this thing about someone was saying that, the tanning people will say that, well, sunlight is natural, it's outdoors, so of course it's good for your skin. No, most things that are natural doesn't mean that they're good for your skin. Poison ivy is natural, arsenic, lead, mercury, all natural. They're not so good for you. So just because something exists in nature doesn't mean that it's good for you or that you should overexpose yourself to it. So being sun smart is the best way to keep your skin looking its best. And my last one-liner, maybe not my last, but my next one-liner is that there's no shortcuts. When somebody has beautiful skin that's radiant, that's healthy skin. When we do things to restore and rejuvenate the skin, it's not just appearance. It's truly a sign of health.
During this show, I use myself as an example, so I don't want to insult anybody. And of course, any recommendation or advice you get during this show, it's not meant to be for you. This is a public health service that we're doing, and you always have to talk to your doctor about this. Did I do a lot of damage because at some point I was kind of youngish and vain, and I was using these sprays, the self-tan lotions and I was buying expensive brands. I thought I was doing a good job, L'Oreal's and some of these brands. Can you do harm using some of those self-tan lotions, or it's not?
We consider those to be safe. The sunless tanners create a chemical reaction within the outer layers of the skin that give that color. They don't really have a great smell, and the early versions were not very smooth on the skin, so they could look streaky and a bit orange. They've come a very long way now, where they have bronzers added and fragrance to mask the terrible smell, but they all have the same basic active ingredient that creates that tan look. And my thing is that if you need to go with a color and you can't kind of perfect your pale, then, or go with your own glow, then that's the better way to go than with the sun. but you need to know that those are not sun protective.
Okay, let's talk about protection against sun. So I've heard you so many times talk about wearing a hat,
Yes.
sunglasses, stay away from the shade. We got that, absolutely. But I got so many questions came online talking about the SPF. What lotions I need to choose, and probably the difference between SPF 15 and 30 is somewhere between 95 to, there's a myth out there, Doris. A lot of people think like I go from 15 to 50 or 100, I get better protection. Is that a myth, or what do you think about this?
Well, you know, it's something we debate amongst ourselves. I think that actually the higher the better. That's my personal point of view, and actually it is based on science. So here's the problem. One is that sunscreen is meant to be your last ditch effort of protection. So when you are going to be outside and you are going to be in the sun, there's nothing else to do, you wear sunscreen. But it's not your only protection, and applying it once doesn't protect you all day long. So I talk about being sun smart. Being sun smart means wearing physical protection, trying to avoid midday sun when you can. That's like 10 a.m. to 2 or 3 p.m. Not always easy, but that's a good idea. Staying in the shade, using a sunbrella or staying in the shade when you can. Wearing a hat, sunglasses, all those things. Now, for the SPF. SPF applies to basically UVB protection, because what they do is they use a certain amount, then they do a lamp in a controlled setting, and they say at this amount of SPF you get this much protection. No one in the real world uses it that way. That's a lab test to give it that number. In the real world, people use a quarter as much or a tenth as much as they should. So as you go higher in the SPF number, you kind of get closer to a reasonable number. So I like an SPF of a minimum of 30. Ideally 50. Now above 50, there's probably a minimal incremental percentage increase in protection. So some people say, oh, it's a waste of money. But sometimes it doesn't cost you more. So it's not really a waste of money. It's the same money.
So that's a very good, I agree with you. I think that's a very good point that you're bringing up. But here, this is what my wife does, and I'm not sure if it's correct or not.
Your wife is always correct. Let's just put it right there.
That's a good point.
If you're watching, you're correct.
So what she uses is she uses 100 on the face and sensitive part of, the arms and legs. And then on the chest may go to I said, give me 50. Are we doing this the right way? What do you use? For example, for your family, do you go 100 all the way?
I use different products, so I use 50 to 60 to 70, depending on which brand or product I'm using. I always look for broad spectrum, UVA and UVB protection, and we reapply it regularly. Now, the neck and the chest actually are more sun sensitive than even the face. I see more damage to the neck and chest at younger ages, and it's so much harder to fix than the face. So I often tell people to protect your neck and chest first, physically and with sunscreen, before you even apply to the face. Another trick is you apply to the periphery of the face before you go to the center. So you're going to apply it all around and then go to the middle, because a lot of sunburns and skin cancers are along the sides.
We actually have a diagram that I want to show you and explain exactly what you were trying to tell us.
Cute.
So tell us exactly how to put this. I never knew there was an art of putting suntan lotion on. Tell us about this.
So I think neck and chest first, then the periphery along the hairline, and then move towards the center and out, because you'll always go back and get more for the nose, because nobody wants their nose to burn. And don't forget the upper lip. And you sweat it off a lot from the upper lips. You have to reapply there often. A lot of lip gloss has shine and hydration, and the lips can burn very easily. So you need SPF on the lips as well, and to reapply it more often.
It's funny because I send you one of my family friends, and people don't realize that you cover your nose and your face and everything else. But this person actually ended up having a lesion behind their ears, and that's where I think a lot of people actually forget to cover that.
Yeah. The part line of the scalp, the ears themselves, behind the ears, the sides of the neck. Your chin protects right underneath it. So a lot of times I see a lot of sun damage, and then right in the central area under the chin, it looks pristine and beautiful because it has its own parasol. And then you see the sun damage coming all around. So you need to protect. And then for that SPF, I want industry to make better sunscreens. If they're limited and we say, okay, above SPF, bad idea, waste of money, they have no incentive to try harder to make better sunscreens. And we need better tools to measure what that SPF does. So technology has to advance a lot more. We're not where we need to be in terms of proper SPF products.
So based on what I hear, make sure you get yourself, it doesn't really matter which brand you use, but make sure you get a brand that covers both UVA and UVB.
Yes.
and start from 30 and go up and cover yourself
Perfect.
well. Reapply every hour
In
to
the
2
back of the
hours.
hands.
Water resistant is absolutely important,
Right.
I
There's
assume.
no more waterproof. It's now water resistant. One of my favorite products is a powder SPF that comes in a 30 or a 50. So for women who have makeup on or they're running around, I always have it in my bag. I just brush it on top, face, neck, chest, back of the hands, my husband's ears and back of his neck, so everybody's covered. And that's a nice way to get reapplication.
It's definitely not going to be a lot of fun to go to the beach with Dr. Doris Day because I can just see her wearing these long sleeves, the umbrella, and covered with all those lotions, but certainly we're learning a lot from you.
Yeah.
Let's jump into skin cancer.
Okay.
Let's put some statistics up about skin cancer, what type of skin cancers and what type of lesions we're going to see. Give us a little statistics about skin cancer out there.
Well, I know you're a urologist, but I have to claim the skin cancer facts here, that skin cancer is more common than breast, prostate, colon, and lung cancer combined. It is the single most common cancer there is. If you're going to pick a type of cancer to have, you want to pick basal cell, because basal cell carcinoma is the most common cancer. But if you find it early, it's very treatable. There's over 5 million skin cancers, as you just had up, every year. Most of them are in the basal cell, squamous cell, or what we call non-melanoma skin cancer categories.
These are small lesions,
They can
scaly,
be
shiny,
Yes.
and that's the kind of lesion you would see. That's a
Right.
basal cell. And then you also have squamous cell.
Squamous cell. And we call them basal cell or squamous cell because that's the layer of the skin in which they come from. And they overgrow. Now, they are not brown. So we're not always looking for brown spots in the skin. When I look for basal cell or squamous cell, and they're not always in the most commonly sun-exposed area, we look everywhere, even where the sun never shines. And these are more reddish. They can have a little ulceration or scale in the middle. And basically, sometimes people think they're a pimple,
Right.
but a pimple should go away in a few weeks to a few months. And this will stay and grow. They tend to stay local. They tend to grow slowly. And we just remove them with a few different techniques. And if they're superficial enough, we can just use a cream to get rid of it. So don't be afraid to show your doctor.
So that's a very good point you brought up. That if you see a pimple type of lesion that's not going away, don't ignore it.
Don't ignore
These are treatable lesions that in your hands and others, they can be resected and they do very well.
Yeah.
Now, the big ticket here is melanoma.
Melanoma. Melanoma is the one that breaks our hearts as dermatologists. Melanoma, family history is a very big case for it, but you don't have control over your genetics. You can't go back and unpick your relatives, but you can control your sun exposure. And that's your single most powerful prevention against melanoma and other skin cancers. No going to tanning beds, no going out in the sun more than you have to. And it's not just sunburn. Sunburns dramatically increases your risk, but chronic sun exposure does as well. So melanoma can occur in any skin type. It can occur anywhere on the body, including in the eyes. So if you have a family history of melanoma in a first-degree relative, get your eyes checked, get your skin checked.
Also lighter color skin, red hair,
Right.
blonde hair,
Definitely.
blue eyes.
Those give you a genetic disadvantage
Right.
in terms of risk. But I've seen melanoma in black skin patients, in dark patients of every single skin type. So we worry
being
about
African
everybody.
American doesn't always protect you,
No.
even though you may have different type of melanin. Let's go to the image, and I wanted actually Doris to go over the whole ABCD mnemonic of melanoma. It's important for people to recognize what to look for. And so maybe you can make comment about these lesions that we find as melanoma.
So this is a patient of mine who had a melanoma. They walked in with this, and this is one that we never want to see. This is a more advanced melanoma, and it has all the characteristics of A, B, C, D, and E that you don't want to see. So let's go over. A stands for asymmetry. So if it's an asymmetric spot, which this one is, that's something to bring to the attention of your dermatologist. B is for irregular borders. You can see this has very irregular borders, and it even kind of fades out into the background at some areas. C is for color variation. This has many colors in it, including red, brown, gray, and that's a sign of regression, which means chances are it's already spread a little bit. And then D is for diameter, greater than a pencil eraser head. I pay the least amount of attention to that because I've seen very tiny melanomas, so I don't go by size in this case. And then E is for evolving. This is something that changes over time. For me, what I tell patients is that if you see something that you don't remember being there, or if it looks different than it always did, bring it to my attention, because most melanomas arise in normal skin, not pre-existing moles. So, but people don't remember, did I have that spot or did I not have that spot? So I would say if you see anything new or changing, show your dermatologist. We'll either reassure you, we look with a special device called a dermatoscope, where we can kind of look through a few layers of the skin. And then if we have to remove it, it's a simple, tiny injection at the spot to numb it. We either cut it out or shave it off, send it to the lab. They send us back a diagnosis. When found early, you have a 98% cure rate.
And remember the statistics. When it's found early, and that's the key, screening in general with every cancer is very effective, but now we're talking about something that's out there. This is the biggest organ of your body, and it's out there and can be detected very easily. And I would recommend, and at least that's what I tell my patients, to get once a year a visit to a dermatologist to really go for screening. For those of you who are watching this and you have no access to doctors, I tell them, like, get a loved one, somebody that you trust, and go from your head all the way to your toes and inspect. Even in between hair areas that the sun is not exposed, you may want to find some lesions and go to the doctor.
But most people come and look for raised spots, and raised is not one of the A, B, C, D, E. There's no R. So it's not usually raised. Most melanomas are flat, not raised. So you have to be careful that way, because people come in and show me things, and the things that they show me, they miss the melanoma, but they look at the raised things. So we have to just make sure, yes, look, and then you look for change. You can take pictures, follow someone, and then find a dermatologist or a hospital near you that has a dermatology residency training program, and definitely get seen and screened by a dermatologist. On your birthday, get your birthday suit checked.
That's a great point.
Way to remember.
You know, it's so easy to talk to her and we can go on for hours. I just want to take a minute break, and then when we come back, we've covered all this screening and cancer. Now I want to know how we can look more beautiful, what we're going to do as far as diet to make ourselves look healthier and rejuvenate our skin. Do we need to get Botox or not? And all the questions that you asked us. So we're going to take a minute break, and when we come back, we'll answer some of your questions. We'll be right back.
Celebrity health stories create teachable moments for everyone. There's been a lot of press surrounding breast cancer, while prostate cancer receives far less. Surprisingly, both diseases share many similarities. There will be an estimated 232,000 new cases of breast cancer diagnosed each year in the U.S. For prostate cancer, it is 233,000. 1 in 8 women will be diagnosed with breast cancer. 1 out of 7 men are diagnosed with prostate cancer. Breast cancer is the most common cancer in women in the U.S. Prostate cancer is the #1 cancer in men in the U.S. Each cancer accounts for about 14% of all new cancers, with a new case diagnosed about every 2 minutes. The average age at diagnosis is 61 for women and 66 for men. There are even many pathologic similarities. Each has gray zone diagnoses and precancerous lesions. Some even share genetic mutations, such as in the BRCA gene. Each has multiple treatment options, with surgery considered definitive for early disease. There is effective screening for each. For women, it is mammogram and physical exam. In men, the PSA blood test and physical exam are important. Talk to your doctor about which screening methods are appropriate for you. Get screened. Consider a second opinion if there is any doubt with your diagnosis. Early detection and patient empowerment are critical. Be your own advocate. Women, please encourage the men in your life to get his PSA checked. It can save his life.
Welcome back again. We have the honor of having Dr. Day, and we're learning so much from her about all type of skin disease and how to make you look more beautiful. Before we get into any kind of treatments, which I'm sure she has a whole panel of them, I want to learn how to get healthier with just simple diet. Can you imagine just adding fruits and vegetables, those phytochemicals, getting rid of those free radicals and antioxidants that we have spoken about in the past? We talked about Mediterranean diet, and how does that affect your skin? Doris, is there truth about what we put in our system can actually glow your skin?
100%. And there's lots of studies that show that the same Mediterranean diet you're talking about will lower your risk of skin cancer and improve how your skin ages. So it's really important to have a diet high in omega-3 and fatty acids, and also avocado, almonds,
nuts,
Yeah, olive oil, fish, fatty fish, salmon, all of those are so good for your skin. And actually, right now we're in harvest season. So we have pumpkins and we have berries and cucumbers, tomatoes. It makes my mouth water. Pomegranate, so good for your skin.
Stuff.
All those colors found in nature are really great for your skin.
I also read that, you know, zinc, vitamin E, vitamin A, beta carotene, and vitamin C.
Niacinamide.
So should people start taking, if they're not taking some of those, of course, with the advice of your doctors, you may want to take some of your vitamins to get healthier.
That's true. There are vitamins. I don't really love the idea of just a plain multivitamin for most cases. I feel like half of the things compete with the other half of the things in there. But there are certain ingredients I really like, and niacinamide is at the top of my list. It's in the B vitamin family. We use it topically, but also by mouth. And copper, zinc, folic acid, all of those really great for your skin in the right doses. You want to try to get it in your diet as much as possible, but also to eat your antioxidants in that way. When you think about it, antioxidants are from plants, not so much from animals or even us, because we're supposed to be smart. When we're exposed to danger, whether it's from UV or pollution, we're mobile. We're supposed to get out of the way. But plants are kind of stuck. They're in the environment they are. So like, take a cactus. It's growing in the worst possible environment. It's in the middle of a desert. It's all sun, all sand, very little in the way of nutrients, but it thrives. It's found a way to be full of water, to have the most beautiful, brilliant colors, and to survive beautifully because it makes antioxidants to protect itself. When we eat those antioxidants, we get the benefits. That's why we have to eat as many colors as we can and to eat them in season when possible.
I think it's also, that's a very good point that you're bringing up. And I also think it's important to make sure that you keep well hydrated.
Yes.
70–80% of our body is full of water, and if you're dehydrated, you're going to add more to your wrinkles.
But all of these plants are full of water, so you can eat your water too. And it's also giving you sun protection from the inside. Doesn't replace sunscreen, but it does give you sun protection. So you can eat your sunscreen that way, you can eat your water that way, and you get all those antioxidants. And drinking the juice is not the same.
That's a good point. And I think like adding vitamin D to your diet is also okay because of all the recommendation of sunscreen. That has gone down. But that's the boring stuff. I want to get to all the juicy stuff. And actually, we always stop at 30 minutes for this show, but I think we're going to take advantage of her and let it roll a little longer because I have more questions. Talk about wrinkles. A lot of people have wrinkles out there. The damage is already done. What do we do? How do we get rid of those? Is there a way to get rid of them? Because I've seen so many ads out there with some of these creams that you put on, and it really makes it before and after is totally different. If you have any of these pictures, we can put them up. What do you think?
Well, the first thing I think is that I'm not against wrinkles. Like, I don't think that wrinkles are necessarily bad or make people look old.
Well, talk to some of my staff that work for me. These ladies are all like anti-wrinkle.
Right. But I think wrinkles kind of get a bad rap in that way. So if we understand a wrinkle and why it's there, there's different types and for different reasons. Wrinkles basically come, most of them are from excess sun exposure, and some of those you want to correct the underlying source. But I go more for balance and harmony. And if you create a beautiful balance and proportion in the skin, you can still get away with some wrinkles and look beautiful. And I don't even think looking older is bad. I don't mind getting older and looking older as long as I look good. I'm not trying to look 20 anymore. My daughter is in her 20s.
You're one of the lucky ones, Doris, because you look beautiful.
Thank you.
And you're sitting here and saying, like, it's not so bad to have a little wrinkle.
Trust me, I do what I have to do. I mean, I get it. But
you take care of yourself.
Of course. But it's within reason. So the patients I worry about, so I ask a question of every patient. I ask them, do you want to look younger or do you want to look more beautiful? And if the idea is to look younger, and there seems to be some overlap, but they are different. To look more beautiful doesn't always mean that you look younger. It means that you look balanced, and when someone looks at you, they just feel good. I mean, you feel good looking in the mirror, and that feels good. But I think beauty is different at every decade, and it can be more beautiful with time and age.
So what's the first line of treatment? Okay. Are you giving them moisturizers to get there?
All right, I'll tell you. So basically...
This is not to avoid people from going to see Dr. Day, but just give me some of your secrets.
It's a combination approach. So it always starts with skincare, and drugstore brands are fantastic. There's really great things you can get right at the drugstore. So there's no excuse to have bad skin anymore because there's so much that you can do. Look for ingredients. Niacinamide, we talked about taking it by mouth, but using it topically in ingredients is great. Retinol, our favorite ingredient as a dermatologist.
Start writing, guys.
Yeah. Niacinamide, retinol, caffeine, peptides, all of those are great. Hyaluronic acid, it won't make hyaluronic acid grow in your skin, but it will help your skin hydrate better. So all of that instantly makes your skin look better. There's lots of brighteners that you can use that also help your skin look better. Vitamin C helps in that way too. Niacinamide helps. These are all topicals and creams, and you don't have to spend a lot of money on these.
And you do that in the morning and at nighttime?
Morning and night. In the daytime it helps prevent against damage, and at night it helps repair. But that thing we said at the top about sunscreen, if you're not using sunscreen, then none of this really makes that much of a difference because the sun is doing the damage. We want to prevent the damage and then help your skin optimize its own repair and rejuvenation.
And for ladies that use a lot of makeup, and I know that, you know, a few years ago, and I still go to Fox, a lot of times when they give you so much makeup, your skin starts to break out. Is there a lotion that you recommend to clean up all that makeup, and what else do we have to do?
I do like the cleansing brushes better than just using your hands and soap and water to get the makeup off, and I like the makeup remover wipes if you have a lot of makeup on, just to pre-clean your skin before. And if you know you have sensitive skin, use ones that are designed for sensitive skin. You can even use, there's inexpensive products, Albolene, it's like a few dollars in the drugstore, really gets everything off to clean before you do. If you're more prone to oil, look for ingredients like salicylic acid. That kind of gets into the pores, gently exfoliates, and can help avoid that clogging of the pores. But don't overstrip your skin because that also can make you break out and look like irritation too. You have to walk a fine line.
Which is what people sometimes do with exfoliation, right?
They overdo it, yeah.
Okay.
Too much isn't good, and sometimes, you know, less is more many times. And so everybody who comes to my office gets a skincare regimen, routine, and follow-up because skincare is as important as any treatment that you do. And then in terms of treatments, it's not one size fits all. It's really one size fits none. You have to know and look at the face as a global aesthetic, and we use a combination of devices, lasers, injectables to create that balance. And sometimes you inject far from where you see the problem to resolve the problem. So when someone says they have hollow under their eyes or eye bags, that's often not the area that is the first problem. When you think about what happens as you age, for women and for men, but we'll talk about women, the brows drop a little bit, right? The orbital bone gets bigger and the eyes can sink in, and you can have changes in the fat pads, which makes you look hollow underneath, and volume loss in the mid-face. None of that sounds so good, but if you then just go and fill underneath, you have a little bit of a heaviness from above, and then you put filler underneath, it pushes the lower lid up. Now you have a poof under here, no hollow, but your eyes look like small slits.
I see,
and
I've seen that actually.
Yeah, it's not an attractive look. If instead I work with a neuromodulator to lift, right, and open the eye, and I contour the cheeks and the mid-face, the eye will look more open, everything looks more balanced, and I haven't even touched under the eye.
I think we have a picture actually that describes exactly what you were talking about. So that's a very important point, because just going to anybody that can inject some fat or some Botox is not going to cut this. And that symmetry and balance, I think, is what you're trying to...
And also understanding that it's mathematical. So I don't know if you know this, but there's a thing called phi. Phi is a mathematical number. And for
Believe it or not,
everybody,
as urologists, we actually went to school and studied about this.
but this is something that's relatively new amongst us. I know you know. But the distance between the inner eye on one side to the other is the same for you from 9 months to 90 years. So that determines the proportion and balance of your entire face.
Let's look at the diagram as we were talking,
and
right.
that can tell me where the peak of your brow should be, the length of your nose, the distance from the upper lip to the lower lip, where the apex of your cheek is. So all of that is a balance. So when I see a big cheek or massive lips, it's sad. And you're absolutely right. You need to see a trained aesthetic physician. We study this all the time. We travel the world teaching, lecturing, studying, observing, both in museums, in our patients, and the science of it.
That's what I would want for my family, if I have a dermatologist who really understands the science behind it. And please don't go to these places where they claim they just take a weekend course and they learn how to inject Botox, and they can really do a lot of damage.
Right.
How many times we see some of these like surgeons that put implants and they are not equipped, and they really can do a lot of damage. We have 5 more minutes left. Let's talk about Botox. Who do you recommend to get Botox, the pros and cons of that?
So Botox and the other neuromodulators is Botox, Dysport, and Xeomin. They're different companies, but they're similar. They are fantastic for retraining muscles, but the goal is never to freeze the face. The goal is to have balance. Again, that word balance comes up over and over. So people don't realize, but if you inject Botox on the forehead, which now Allergan just got the FDA approval, that means you can't use your forehead muscle. And your forehead muscle is a lifting muscle. It's raising the brows. And to me, that's not the best place to put it, because I never want to take away anything that's lifting, right? I want to just soften things. But when people want a frozen forehead, I never understand why that looks good or why that's the goal. I think movement is important, and successful Botox means that you look better. No one can tell you've done anything. Your brows are symmetric, your eyes are open and lifted, you can still move, and you just look beautiful. So it has to be a subtle look, but it's hard to make it look subtle. It's easy to eliminate all lines.
So experience plays a big role. You really have to...
You know, the products are so commoditized because they have a great safety record, so everyone thinks anybody can do it. But if you buy a nice piece of fabric, that doesn't give you a great suit.
Absolutely. That's a very good point. So if you have questions for Dr. Day, and I'm sure there are a lot of people out there who want to learn more and understand this more, you can go to Dr. Samadhi TV or on social media and send your questions, and I will forward to her, and I'm sure she will get back to you. We're running toward the end of the show. I want to ask you one more question. We had someone by the name of Yvette from Riverdale that sent a question about blue peel. How often should everyone get blue peel, and what's the advantage or disadvantage of it?
So a blue peel is just another form of a peel that can help brighten the skin. There's so many peels out. That was one of the earlier peels that were available, and so we didn't have as many choices, and it's a fine peel, but I think we've evolved in many of the peels that we have available. It depends on how your skin tolerates it, how much sun exposure you get. You can do it as little as once every few months. It depends on the quality and the strength. It's just another brand of a peel, but chemical peels can be good. You don't want to overdo it, and it does matter who does those as well. Those can do harm and cause chemical burns of the skin. So really, you have to be careful with the peel. See your aesthetic dermatologist and have them guide you for the best treatment for you.
You know, it's incredible because, you know, over the years I've studied this topic so many times, and you think you know enough, and then when I sit next to you, I understand like how much more there is to this. Yeah. Continue to do all the work that you do. It's a pleasure to have you. I can't believe how fast the time went by. I understand you have a book coming out in January, which you will come back. I want to promote that book because everybody needs to learn this. And I always try to like finish the show with good music.
Oh, good.
Okay, because when you're happy, you're going to smile more. When you smile more, your stress is gone. Stress is gone. You're going to have a better skin.
Beautiful.
I'm so happy to have you. Thank you very much for coming.
Great to be with you.
Yes, and we'll have you more often. So for further questions, go on social media. Send your question on social media. We're here to answer, and we'll have Dr. Day in the near future. Thank you again.
I love that.